Hi, I'm Dr. Steve Grinstead, author of the book Managing Pain and Coexisting Disorders and developer of the Addiction-Free Pain Management System. Today I want to talk about what do you do when someone is suffering with chronic pain and is also experiencing a coexisting addiction. A lot of people get very frustrated and angry about this because there's still a mistaken belief with pain patients and pain treatment providers that if someone has legitimate physical chronic pain and is taking the medication as prescribed, they can't get addicted. Now, for about 80 to 85% of the population, this may very well be true. But what about that 10 to 15%, which might be as many as potentially almost 1 million people in this country? What do we do about that? A lot of people really don't want to address this, don't want to talk about this. There's a sense of hopelessness, helplessness, or even outrage and anger. A lot of people who are suffering from addiction have a disease whose major symptom tells them they don't have a problem. Other people have a defense mechanism of fear of change where they're afraid they won't be able to cope without their friend, the pain medication. I want to let you know that there is hope. There is a way to do this. And by the way, some people who get tagged as pill addicts or medication addicts may not be. It might be pseudo-addiction, which to put it really simply is undertreated or mistreated chronic pain. Now, if you are watching this video on YouTube and want to learn much more and go much more in depth on managing pain and coexisting disorders, please check out my professional blog at the link below. Or perhaps you might be interested in my book, Managing Pain and Coexisting Disorders. Knowledge is power. The more people know about what's going on, the better they are able to address it appropriately. But as Khalil Gibran says in his book, The Prophet, a little knowledge that acts is worth infinitely more than much knowledge that is idle. So, in other words, all the knowledge in the world isn't going to help you if you don't get into action. However, if you don't know what the problem is, you'll not even want to get into action. So please, learn as much as you can. If you know someone or you are someone who is questioning that there might be a problem with medication management, please check out my professional blog. I'd really encourage you to learn as much as you can about chronic pain, addiction, and pseudo-addiction so this doesn't happen to you. If you happen to be in recovery from alcohol or other drug addiction, you really need this information and knowledge because it could save a potential relapse episode. I believe that freedom from suffering is everyone's right. However, I believe it's also a responsibility. So please help me get the word out and share this information about helping people who have chronic pain and co-occurring disorders, including addiction. Thank you.